The Maternal and Child Health Department of the Milton K. Memorial Hospital held its 22nd Annual Perinatal Mortality and Morbidity Conference on Thursday, the 22nd of February 2018 at the National Insurance Services Conference Room. This year's conference had a focus on the reviewing of the performance of maternal and child health in the perinatal period. Comparisons were made and trends sorted with an aim at improving care. For the first time, participants from outside of St. Vincent and the Grenadines, apart from the consultants, were invited to analyze the data. This came about after Dr. Boyle presented on the conference, and it was recognized as a potential best practice. This ties in with the goal of the Milton K. Memorial Hospital Committee. The goals of the National Economic Social Development Plan seeks to enable increased human and social development with specific strategic interventions to expand secondary and tertiary healthcare services to include new treatment modalities and strengthen primary and secondary healthcare programs and services, resulting in reduced infant mortality rates and increases the health and productivity of the working segment of the population. The goal also aims to reduce under 5 mortality rate from 18.4 per 1,000 to 8.0 per 1,000 live births, consistent with the Millennium Development Goals target. So we're at this 22nd Perinatal and Morbidity Conference, and we are with two wonderful doctors who are going to tell me exactly what their function is and just tell me a little bit about today's proceedings.
I'm Dr. Rosemary Boyle. I'm the consultant pediatrician at Milton K. Memorial Hospital. Well, today we are marking the 22nd anniversary of our annual perinatal conference, where we present the work of the entire department for the entire year, and we do comparisons of years gone by. The whole idea and objective behind this is so that we can see what we have done wrong, what we have done right, and how we can improve in the years to come.
All right, thank you. Dr. Slater, 22 years going strong.
Yes,
you
going
started
strong.
this from the inception, and you're still here giving support and guidance. Tell me a little bit about today and what it means for you.
Well, today is a tremendous achievement because we have gone 22 years, and as you see, PAHO has been embracing it. They're recognizing it as a best practice, trying to see if they could get it introduced in the other islands in the Caribbean, because once you do that, you can see, as Dr. Boyle said, you can see where you're going wrong, what we have done well. We can commend our staff. We take the opportunity to tell the staff you have done well, or if you haven't done well, this is what we need to do. It also helps to bring the staff together because the whole team is here.
Right.
Team from the ministry, team from different departments in the hospital, from the lab, infection control. So everybody is here analyzing, looking at, and it's a team approach. It's a teamwork. And therefore, it's really, really great to have this on every year, and we hope it will continue forever.
There's a new component this year. There's a workshop tomorrow. What will that mean for what is the work that is being done?
Okay, that is because, again, PAHO recognized it as being best practice for the hospital itself, and they want to expand it some more for us to have more detailed discussions, how they can improve our data collection. They will give us advice as to what they think we're doing right, what we're doing wrong, and how we can do it better. And they have also invited other participants from the Caribbean region, St. Kitts, St. Lucia, Barbados. They will be here, and they themselves will also present tomorrow their information, their data. We'll all discuss. We'll knock our professional heads together, and at the end of the day, we'll have a better conference and better outcome next year.
We're here with Mr. Pablo Duran, and he's a regional advisor for PAHO on perinatal health, and he's going to tell us a little bit about his capacity here this morning, as well as how has he found the conference so far.
Thank you. Good morning, and we are pleased to be here. We are really interested in this process that St. Vincent is taking since 22 years ago, and this is timely because from the regional perspective, going in deep on the analysis of neonatal, fetal and maternal mortality is really important to improve the quality of care and the results in the population. So we are from PAHO really proud of this process, and we are promoting these experiences not only here in St. Vincent but in other Caribbean countries and in the regions.
Based on what you've heard so far from the presentations this morning, how do you find the conference?
I found very very important and very exciting, the results, the improvements that have been presented, and this is the result of a continuous improving of quality of care. And this process of reviewing processes is the key issue for improve the results and to provide better health care for the population.
So we're here with Dr. Lucilla Charles, and she's one of the representatives from St. Lucia. Welcome to St. Vincent.
Thank you.
Tell me, how have you found the past 2 days of this perinatal conference?
Oh, exhilarating. I have to say I came on the background that it was a holiday in St. Lucia, the 22nd, our independence, and I was not very enthusiastic about coming. But then it has been worth my while. The teaching sessions have been amazing. What has been done here in St. Vincent for the past 22 years is invaluable. So I'm very, very much happy with what I've seen. A lot of learning so we could take back home and improve what we are currently doing.
How do you think the other persons who have been here have responded to what has been shared?
I think I get a sense of family here, and I think persons are very mature. It has not been a question of comparing, but a question of trying to help and improve what we do overall, because we're a region. While we're individual islands, I think we impact each other significantly, and that's what has been the prevailing sentiment of camaraderie, of trying to help each other.
What would be the main thing that you take back home from St. Vincent to St. Lucia?
I think the warmth. I sense that there is warmth, and that is very important, and of course to continue. I think perseverance is what I see here. We started this thing 22 years ago, and we're still continuing. So perseverance is a very, very important virtue. I appreciate it very much.
Dr. Beryl Irons, welcome to St. Vincent again, my fellow Jamaican.
Thank you very much. It has always been my pleasure to visit St. Vincent and the Grenadines.
22nd Perinatal Conference. You are here contributing. You did a couple presentations, and so how have you found this conference this year?
It has been excellent. I think there have been many progress that I see in many areas since over the years, having visited the conference. And the last conference I came to was in 2015 with a review of 2014. And I must say that the programs have moved forward. There have been many achievements, and I think the Ministry of Health and the health staff have a lot to be proud of.
So we're here with Sandra Lesrod Kane, and she's out of St. Kitts. Welcome to St. Vincent, and tell me, how have you found the conference for the past 2 days?
Let me first thank St. Vincent and the Grenadines for taking the initiative and having this perinatal conference. I find that the conference was quite informative, and I really like to commend the level of information that was shared, and I can only trust and hope that this conference would be shared with other persons from different regions, because the information can use to be guided by putting systems in place to improve the maternal and perinatal persons that can benefit from it. And I also want us to recognize that even though we are separated by geographical boundaries, whatever is going on in St. Vincent, it can deeply affect the other countries in relating to maternal and child health. So I do want to thank the persons from St. Vincent and the Grenadines and PAHO and CLAP, all the organizers, and commend them for this initiative, and only trust and hope that we'll continue to improve what we are doing to improve the quality of life of our maternal and child health.
What is the main thing you think you'll take back home from what you've learned here?
One of the main things I can take back home is to ensure that I can advocate for the importance of surveillance and monitoring and collection of statistical data, because it is basically guides us on the factors that can prevent us from providing the quality care that our mothers and children really should be getting.
So we're here with Dr. Gillian Birchwood. This is her second time here in St. Vincent and the Grenadines.
Second time in this particular
In
capacity.
this particular capacity.
I've been here before on a holiday and all of that. Nice place to visit.
All right. Tell me, how have you found the conference from the last time you came to present time? How have you found the conference over the last 2 days?
Well, I have found the conference to be very, very enlightening. What always strikes me when I have had the opportunity to be present at one of these conferences is the high level of teamwork that goes on across all disciplines. So, you have between obstetrics and pediatrics, the community nursing. I'm always very impressed by the amount of teamwork. And it shows in the outcomes that you have had because everybody's really striving towards a common goal. So I was very impressed about the successes that St. Vincent and the Grenadines have had and their continual insistence on striving for excellence for the patients. I'm really always very impressed and I take a lot of inspiration from that.
What is the main thing you think you could take home to help in terms of your maternal health there?
The teamwork. I think that perhaps people take it for granted here, but this degree of teamwork is above and beyond what you would typically find in a healthcare system. And I think that fostering teamwork really is the secret key that they have discovered here in St. Vincent and the Grenadines, that not only can we learn from them from the rest of the Caribbean, really and truly the rest of the world can learn from this degree of teamwork and working together towards a common goal.
And based on your observation, what would you say is the general feedback for other persons that were here from like other islands and stuff?
I think that they were similarly impressed with the teamwork and the commitment of every single person who's involved in care of the mother and the child. It's really very obvious. The passion for patient care and the passion for excellence is something that I think that everybody would have noticed.
All right, thank you so much for taking the time to do this interview with us.
You're very welcome. It was definitely my pleasure to be here.
All right.